Hi everyone, I'm Jennifer Kimball and this is my pharmacology teaching project for Nursing 312 Pharmacology and Pathophysiology. My topic is anticoagulant therapy. Anticoagulants are a class of drugs that interfere with the normal coagulation process by interfering with the clotting cascade and thrombin formation. The most commonly used of available anticoagulants include Pradaxa, Xarelto, Coumadin, Eliquis, and heparin. Xarelto, Pradaxa, and Eliquis are the newer anticoagulants on the market, while Coumadin has been the principal oral anticoagulant for more than 60 years. Pregnancy categories vary between the different drugs. Warfarin has been assigned to pregnancy category X by the FDA. Problems associated with perinatal administration of warfarin have included central nervous system defects, spontaneous abortion, stillbirth, prematurity, hemorrhage, and ocular defects when given any time during pregnancy, and a fetal warfarin syndrome when given during the first trimester. Warfarin is considered contraindicated during pregnancy. Pradaxa, Xarelto, and heparin, however, have been assigned pregnancy category C, meaning it's not known whether the drug will harm the unborn baby. Eliquis has been assigned pregnancy category B, meaning there's no proven risk of harm to an unborn baby with use of this drug. Each different anticoagulant has a unique mechanism of action and is FDA approved for various cardiovascular indications. Coumadin is approved for prophylaxis and treatment of thromboembolic complications associated with atrial fibrillation and/or cardiac valve replacement, prophylaxis and treatment of venous thrombosis and its extension, pulmonary embolism, and to reduce the risk of death, recurrent myocardial infarction, and thromboembolic events such as stroke or systemic embolization after myocardial infarction. Xarelto is approved for prophylaxis of deep vein thrombosis, which may lead to pulmonary embolism, and to reduce the risk of stroke and systemic embolism in patients with non-valvular atrial fibrillation. Pradaxa is used to reduce the risk of stroke and systemic embolism in patients with non-valvular atrial fibrillation, as is Eliquis. Patients should be assessed for allergies to anticoagulants prior to administration, and these drugs should not be used in patients with any conditions that could be compromised by the risk of increased bleeding, such as hemorrhagic disorders, recent trauma or surgery, spinal puncture, GI ulcers, IUD placement, TB, or the presence of indwelling catheters. Caution should be used in patients with heart failure, thyrotoxicosis, senility, or psychosis due to the potential for unexpected effects, and in patients with diarrhea and fever, which could alter the normal clotting process by loss of vitamin K from the intestine or activation of plasminogen. A baseline assessment should be conducted prior to administration to determine any potential adverse effects. This would include body temperature, skin color, lesions, affect and orientation, reflexes, pulse and blood pressure, perfusion, respirations and lung sounds, clotting studies, renal and hepatic function tests, CBC, stool guaiac, and possibly an EKG if appropriate. Serious side effects occur when adding or removing a drug from the regimen of a patient on anticoagulant therapy without monitoring and adjustment of the dose. Patients should be educated never to change their medication regimen without consulting their treating physician first. It is recommended that patients on anticoagulants wear a medical ID bracelet to alert emergency personnel that they're on this class of drug. Patients should also be regularly assessed for signs of blood loss such as petechiae, bleeding gums, bruises, dark-colored stools, and urine. Safety precautions should be discussed and implemented, such as avoidance of contact sports and electric razors. Additional precautions should be taken to prevent against bleeding during invasive procedures, such as the use of pressure dressings, avoidance of IM injections, and not rubbing sub-Q injection sites. The charts of patients on anticoagulants should be marked to alert personnel of the increased risk for bleeding, and an antidote should always be kept on standby, for instance, vitamin K for Coumadin. A 2012 article published on www.naturalnews.com reported several natural substances that possess powerful anti-inflammatory properties and also help to thin the blood. They cited spices such as turmeric, ginger, and garlic, as well as the enzyme bromelain and regular water. The article promotes these natural remedies in lieu of pharmacologic agents, stating that they do not have the same adverse side effects such as internal bleeding. On his website, Dr. Andre Weil also lists ginkgo, dong quai, feverfew, fish oil, vitamin E, and tree ear mushrooms, available in dried form in Chinese grocery stores, as having anticoagulant activity, although he does not recommend using these alternative therapies as substitutes for prescription anticoagulants, and cautions to consult a physician before starting any alternative therapies. Special consideration should be taken when prescribing anticoagulants in the elderly. According to an article by Robert Ebadi, Legal, and Regini in 2009, there is an increased rate of bleeding and major bleeding in patients over 72 years of age compared with those under 72 years. 14.1% versus 7.1% for bleeding and 11.1% versus 3.1% for major bleeding. Because renal function decreases gradually with age, assessing renal function is important when prescribing anticoagulants in the elderly. Several medical conditions are known to increase bleeding risk during anticoagulant therapy, including hypertension, cerebrovascular disease, ischemic stroke, serious heart disease, diabetes, renal insufficiency, alcoholism, and liver disease. Most of these conditions have a higher prevalence amongst elderly patients and should be taken into account while estimating risk-benefit ratio of oral anticoagulation. Another major concern when prescribing anticoagulation therapy in elderly patients is the risk for falls, as there is an increased risk of intracranial hemorrhage in patients with atrial fibrillation at high risk for falls. According to a 2015 article written for the British Journal of Neuroscience Nursing, atrial fibrillation is the most common arrhythmia and is estimated that 1 in 4 individuals aged over 40 years will at some time develop the condition. The article states that despite these figures, there are still many patients who are not receiving effective treatment for atrial fibrillation. The National Institute for Health and Care Excellence guidance recommends that all patients with non-valvular atrial fibrillation receive a personalized package of care. The goal in this is to support the patient in making an informed choice regarding their treatment regimen through the provision of individualized information and intervention regarding their atrial fibrillation diagnosis and treatment plan. There is growing evidence around the effectiveness of developing more of a self-management culture within healthcare, with the idea being that patients that are informed about their health are more likely to engage in treatment regimens. This article also lists Pradaxa, Xarelto, and Eliquis as 3 drugs that have been termed novel oral anticoagulants, or NOACs, and are recommended to be used as an alternative option to Coumadin. A 2014 comparison of the available randomized trials of these drugs has been performed and demonstrated statistically significant overall reduction in stroke and systemic embolic events, a trend towards reduction in all-cause major bleeding, and a statistically significant reduction in hemorrhagic stroke and all-cause mortality when using NOACs compared to dose-adjusted Coumadin in almost 30,000 patients. A common concern amongst healthcare providers with these newer drugs, however, is that agents to reverse these anticoagulants are still under investigation. Reversal of an overdose of oral anticoagulants is important in minimizing mortality. No specific antidotes are available for Pradaxa, Xarelto, and Eliquis. Activated charcoal may reduce absorption of the drugs from the GI tract in cases of overdose, and hemodialysis might help rid the body of medication that already has been absorbed, but there is still research to be done. That concludes my presentation. I want to thank everybody for listening, and I hope that I taught you something new. Thank you very much.